Okay, so welcome back. This is the part two of our video lecture for mechanical ventilation, where we're talking about ventilation modes or ventilator modes. So we stopped at APRV or pressure release ventilation. So just to recap, we said that this is basically for patients that are able to spontaneously breathe, and they could trigger both low and high pressures. But this mode is very likely, or it likes the high pressure because it's more for like a lung protective in kind of mode. So um, as we said, the CPAP, this gives like a CPAP, but more like a variation. So it's giving you variation of different kinds of CPAP level, in a sense, and it also terminates temporarily on the exhalation. So um, APRV will give you the same pressure that you set on the inhalation and will stay there for the duration of the breath, and when it cycles off to exhalation, the pressure will be cut off, so it will terminate temporarily, and then we'll put it back when the patient is triggering another cycle of inhalation. So that being said, this mode is sort of kind of requires a little bit more of like a sedation. Now that might kind of sound a little bit of kind of odd because I said it's patients that are able to spontaneously breathe. That's why this is not really kind of like a good mode to put patients in, because you know the patient, it requires the patient to kind of spontaneously breathe, but at the same time, you know patients kind of tend to not tolerate this mode. That's why you um, they require more sedation. So that's basically it for APRV. So just remember, it's like a variation of CPAP, but patients that can spontaneously breathe um, can trigger high and low pressures, but it likes high pressures. I guess that's why patient requires more sedation level, because our lung can only take so much pressure inside, and we might end up popping our lungs and causing pneumothorax if we continue on giving high pressures all the time. So next up we have a spontaneous breathing mode. So this it's called pressure support CPAP, or pressure support continuous positive airway pressure, or as we all know for PS slash CPAP. So this mode is basically for a weaning process. So when the patient is ready to come off on a ventilator, we put them on a PSC PAP to see if they could actually spontaneously breathe on their own. And we usually tell the patients that okay, it might feel a little uncomfortable because you are breathing on your own, so you are doing more of your working rather than the ventilator working for you. So if they tolerate this mode, then they could potentially be extubated. And that being said, this is not the only one that you have to pass in order for you to get extubated. You need to do a whole weaning process or weaning parameters in order for you to, or in order for the patient to be extubated. But this is one of them. So it's just basically helping them breathe if if they're having trouble breathing. So it's just giving you that support. So it's not really, the ventilator is not really actually doing the job for you for breathing, but more like being a support. So it says in here that we could this pressure support CPAP could be delivered both, or it could be delivered you know separately. You have a choice of having pressure support CPAP, or just pressure support, or just CPAP only. Now, if you want the patient to be put on just CPAP only, which is like one of the weaning parameters that we do, or weaning processes that we do, is we put the pressure support to 0, and then we just leave the CPAP as it is. Now, it's going to be vice versa for the pressure support. We're going to just put the CPAP to 0, and then pressure support will be maintained on whatever we set it on. So, pressure support above PEEP is set. When the patient initiates a breath, the breath will be delivered with the set pressure support. So, that's what what I was telling earlier, that when the patient initiates a breath, it's giving you that support. So the ventilator is just giving you support instead of actually giving you the full work of breathing. And then in this mode, the patient determines the breathing rate and then the inspiratory time, because it's solely kind of focused on the spontaneous breathing of the patient. So the patient is actually, triggering the breath rate and the inspiratory time. And then since it's a spontaneous breathing based ventilator, the ventilator only gives support every breath triggered by the patient. So it's just basically overall the take home part for the pressure support CPAP is that the ventilator is just giving a support so that the patient could kind of help the patient move towards the patient breathing on its own only. So it's just helping it kind of like walk through just being by itself, or being independent rather. So after that, we're just going to differentiate between volume and pressure control mode. So as we said earlier, the volume, we set volume, and the pressure varies. And then for pressure is set, volume varies. For the waveforms for both, excuse me, volume will show shark fin for its pressure, because it's just slowly increasing while the volume is being achieved. So for pressure, it's more like a waveform. The waveform is more of a square, so it's just shooting up to that set pressure and maintaining that pressure for quite some time, or until exhalation is ready to be done. And then peak pressure will on volume control will vary, because we're giving variety, or variety of pressure. So the pressure is not constant. That means that the peak pressure is going to be variable, or it kind of fluctuates. As for pressure control, peak inspiratory pressure will be set. When you put 20, the PIP will just be 20, and that's it. So for both, setting the alarms, especially for the upper pressure alarm, is really good, because sorry, I blanked out. It's good because we don't want to create more lung problems or create lung injuries on giving too much pressure. So setting a pressure alarm, upper pressure alarm, will limit the pressure that is being given to the patient. So that's basically what it is. And then for pressure, we set the I time, and then for volume control, we normally don't. So let me just look at my notes. So, as I said earlier, just to go back for the pressure CPAP, our normal pressure is at 5, but it could go up to 10. So the 5 to 10 is the range for the normal pressure. Just a little side note for that. And then for CPAP, sorry, let me go back. It's just giving you basically a positive pressure all throughout the cycle of the breathing. So it's just basically, helping the alveoli keep open, in a sense. So that's the difference between volume and pressure. And I'm going to explain this graph or the waveforms on the next video. Thank you.